Hello everyone, I'm Dr. Vivek Venkatramani, consultant uro-oncologist and robotic surgeon in Mumbai. Today I'll be talking to you on penile cancer, which is one of the rarer cancers among men. However, in countries like India, which has a lower socioeconomic status, it is still quite a common cancer. Penile cancer is one of the rarer cancers affecting the male reproductive organs. However, in countries like India, it is still quite a common problem. Penile cancer generally has certain risk factors which include poor hygiene or an inability to retract the foreskin and clean under it. This allows the smegma or the dirty material to remain there and then cause changes in the skin and the glands of the penis, and over time this may predispose to penile cancer. Certain communities like the Muslim or Jewish community in whom neonatal circumcision is practiced generally are never affected by penile cancer. Other risk factors for penile cancer include human papilloma virus infection or HPV infection. Today a vaccine is available for HPV and some authorities do recommend giving men under the age of 24 or 26 years of age this particular vaccine in order to reduce their risk of penile cancer as well as the transmission of HPV to their female partners who develop cervical cancer in the future. Some rarer risk factors include smoking as well as exposure to ultraviolet light. Penile cancer generally presents as an ulcer or swelling over any part of the penis. The most common parts affected include the foreskin and the glands. In certain cases, it may affect the shaft of the penis as well. Most men are really embarrassed about something growing on their penis and therefore they don't seek help immediately. They often wait and wish it away, and over time the cancer grows and may involve the entire shaft of the penis as well. If these growths get infected, there may be some discharge coming from the growth as well as foul smell, and this is generally associated with phimosis, which means a complete inability to retract the prepuce or the foreskin, and the mass grows progressively under that, gets infected and progressively enlarges. The most common site of spread of the cancer is to the lymph nodes in the legs, which are known as the inguinal lymph nodes or the groin lymph nodes, and from there the cancer may of course spread to other organs in later stages like the liver, lung or bones. In fact, the presence or absence of inguinal lymph node disease is the single most important prognostic factor or the factor that affects the man's survival. Evaluation of a patient of penile cancer generally involves just a local examination where we can clearly see what is going on. We then examine the patient's lymph nodes and look for any palpable lymph nodes in the groin region. For local staging, we may do an ultrasound of the inguinal region, especially if the man is a little obese, which makes it hard to feel the lymph nodes in that area. A CT scan or a PET scan of the abdomen and the chest may be done to look for spread to other organs or to lymph nodes within the abdomen, which are known as the pelvic lymph nodes. First of all, a biopsy from that lesion will be taken just to conclusively prove that this in fact is cancer. There are very rare mimickers of cancer like tuberculosis or certain skin diseases which may also appear similar to cancer on examination, and before we do any major surgery, it's always better to have a biopsy. Once the biopsy proves that there is cancer of the penis, then the treatment will depend on the stage and the size of the local tumor. Basically, surgery is the mainstay of treatment. It will involve either a partial penectomy, in which the mass and a normal part of the penis, at least a margin of 1 to 2 centimeters, depending on the type of tumor, is essential in order to completely remove it. This is again quite a small procedure in terms of the majorness of the surgery. Patients will go home in a day. They will have a catheter for the urine for about a week after the surgery, and it has a very high success rate or cure rate as long as the margin of disease is negative. Partial penectomy is generally done for smaller tumors which are more distally located, that is near the glans or the foreskin of the penis. It's important that the man has a normal at least 2-inch stump of penis remaining after the partial penectomy, which will allow him normal urination in a standing position. For more advanced or larger growths, what is known as a total or radical penectomy may be needed. In this, the entire penis, including its roots which are attached to the pubic bones, are removed completely. The urinary passage is then created behind the scrotum in the form of a perineal opening or a perineal urethrostomy. This necessitates that the man will need to pass urine sitting down and holding the scrotum in front in order for the urine to flow naturally. Depending on the biopsy of the tumor, we then decide whether or not the lymph nodes need to be treated. In men who have no lymph nodes that are felt or that are seen on an ultrasound or CT scan examination, there are certain high-risk features of the tumor which would necessitate a small sampling or a modified dissection of the lymph nodes in order not to miss any microscopic disease that might be present there. This is known as a modified or superficial inguinal lymph node dissection, which is done in men with high risk features like high grade tumors, T1 or higher disease, or certain specific aggressive forms of penile cancer. In men who have clearly palpable lymph nodes, we sometimes do an FNAC, which is a small needle aspiration of that lymph node to confirm that there is cancer there. And we may do a complete inguinal lymph node dissection at the same time as the primary penile surgery once we have proven that the cancer has spread there. Inguinal lymph node dissections, especially a radical one, does have significant morbidity because basically we are interrupting the flow of all lymph from the lower limbs, which are the legs, into the pelvis and back into the circulation. This can therefore cause sometimes swelling of the legs, which is known as lymphedema, certain problems in the skin of the surgically operated site, cellulitis or lymphangitis in that area, and difficulty in healing of the flaps that were used during the surgery. So today, minimally invasive approaches like laparoscopic inguinal lymph node dissection or robotic inguinal lymph node dissection are being used more and more frequently in order to reduce these skin complications of lymph node dissection. In men in whom the cancer has spread to the pelvic lymph nodes or who have 3 or more positive lymph nodes, chemotherapy may be needed after the surgery in order to improve their survival and prevent any further spread of the disease. Penile cancer has a good successful outcome, especially in the early stages. However, given the fact that men are so embarrassed and so psychologically disturbed with the thought that there may be something wrong in that region, they often present to us when the cancer has spread, especially to the lymph nodes, which is one of the most poor prognostic features of the disease. So if you have any doubt or if you notice something abnormal, an ulcer or a small growth or an inability to retract the foreskin, so please don't delay and contact your doctor immediately if you think something is wrong. If you found this video beneficial, please do like and share it with others, and don't forget to subscribe to my YouTube channel. Thank you.